Specifically, can I remove this one? Specifically, we will focus on surgical wound. Okay, let's say we have surgical dressing. And the basic concepts in this topic has been discussed already in theory, the different types of wounds, what are the treatments, all has been discussed already. So for the purpose of our lab session, we'll start with surgical wound dressing. Normally, I start this procedure by showing them this flow chart, because our students, they are familiar with clean technique, like the procedures that we usually do, which utilizes clean technique, but they're not familiar with sterile technique. That's why I usually present this flow chart for them to know that clean technique and sterile technique are ways on how to control infection, like what we have there. And the very purpose of clean technique and sterile technique is to prevent hospital-acquired infection, bloodstream infection, and surgical site infection. You need to understand this concept first. And then, in your discussion, try to move on the difference between clean technique and sterile technique. And what do they do if the procedure is utilizes clean technique? What do they do if it is sterile technique? They need to understand those things. Normally, I show them this slide with regards to clean technique. And I need to inform them the goal, which is just to reduce the number of microorganisms. And normally, clean technique is utilizes if they're going to touch intact skin, intact mucous membrane, and dirty items. And on the last box, it will show them what are the things that they need to perform if the procedure requires clean technique, such as the usual hand washing that they have, putting on the clean gloves, and using the PPE. And this is important. You need to tell them what are the examples that utilizes clean technique, specifically the procedures that they have done already since week 1. Just like the yellow color coded letters, like injection, they do hand washing, hand rubbing, they wear gloves. That's part of clean technique procedures. Giving bed bath, if necessary. Okay, NGT feeding, checking vital signs, specifically the temperature, checking of blood sugar, and oral care. Those procedures requires clean technique. And this is the most important thing. How it is different from sterile technique, because this procedure requires sterile technique. In sterile technique, the goal is to eliminate, show them the difference. Clean technique is just to reduce the microorganism. But sterile technique, we want to eliminate, to destroy microorganisms that can cause infection. And normally we perform this one if we touch wounds, non-intact skin, body cavities, break in the skin or mucous membrane, and those procedures where the infection rates are very high. And since this is a sterile procedure, which utilizes sterile technique, we are employing some measures. For example, surgical hand washing. And this is new to them, because students, they know already what is medical hand washing in the first week. But this time we will show them the difference between medical hand washing and surgical hand washing. Sterile glovings, again, your students might say, we know how to do glovings, but using the clean gloves. This time, using the sterile gloves itself. Sterile gowning, we will not do it, but in the hospital, they are doing it as part of their measure. And sterile draping, later on we will going to show them how to drape the wound, the surrounding environment. And again, show them among the procedures that we have in the lab, what are those that require sterile technique. And normally, we have identified 2. Insertion of urinary catheter, because the bladder is sterile, it requires sterile technique. And most importantly, if they are cleaning a surgical wound. Okay, because the infection rate is very high in those procedures. That's why a sterile technique is required. Okay, and then after you show them the difference between sterile technique and clean technique, it's time for you to introduce our topic, which is surgical wound. And you start by defining what is surgical wound and what are the complications common to surgical wound, which is surgical site infection. And ask them, how do we prevent their surgical site infections? The answer is wound dressing. Okay? And there are 2 reasons why wound dressing is performed: prevent growth of microorganisms and promote wound healing. And they will understand that these are examples of surgical wound that they would see in the hospital. Okay? Now, there are things that they need to remember because during assessment, they might hear certain term which they are not familiar. For example, during assessment, they will assess for wound approximation. Tell them, what is wound approximation? Wound approximation means edges of a wound are close together. That means the wound are approximated. In case of infection, in case of complication, edges are not approximated. Okay? The term is wound approximation. And show them these photos, the difference between the two. A normal wound and the wound which is complicated.
Infection.
Okay. Part of their assessment also is they need to identify the exudates. That's why we need to teach them what are the different types of exudates that they can see when they assess the wound. And there are 4 types of exudates. By the way, this has been discussed already in theory, but I want you to review them. Okay? Specifically, the importance of each exudate. For example, right after surgery, they might expect smaller amount of sanguinous exudate, which is bright brick red in color. Okay? And normally, after several hours to few days, the exudate would turn to serosanguinous, which is colored pinkish. Okay? And after a few days, if the healing is normal and if the healing is healthy, it might progress to serous, which is clear and transparent. However, if they are suspecting infection in the wound, they might expect a purulent. The color of the exudate is greenish, brownish, yellowish, because it contains dead cells and it contains white blood cells. Emphasize to them also that the presence of sanguinous after several days is not normal because it means there's an active bleeding. It is normal after a few hours or in the first initial hours after surgery, but it is not normal after several days. Okay? Because they need to describe it in the gauze. The exudate is like this. Okay, part of their assessment also is they need to identify for the presence of wound drainage or wound drain. And of course, they need to understand what are the common wound drain that they might see adjacent to the wound. And these are the common types of wound drain that we usually have in the hospital. Okay. However, since they are beginning students, okay, it is very important for you to explain to them what's the purpose of wound drain. Okay? To remove excessive exudates in the wound area, or else the wound will not recover if the exudates is very high. Okay? Maybe you can discuss a few nursing interventions how to maintain this one. The negative suction should be maintained. But the higher level of knowledge on wound drain, don't discuss it anymore. The basic only for their level. Okay? The Hemovac, the Penrose, and Jackson Pratt. These are wound drain. This collects exudates and blood from the wound site in order to promote wound healing and recovery. Okay? They will ask what is they will ask you what is the role of a nurse if there's a wound drain. Already it should be collected every hour, every shift, and it should be recorded, and etc. Those things.
In theory, you discuss Penrose and Jackson Pratt or not?
Yes.
So they know about it.
Just do a review.
Yeah.
Yes, because students.
And we can make by latex gloves. We can make Penrose.
Yeah. Actually, we have Penrose before. In certain mannequin we have. I do not know now if we still have. Okay. Now, those are important terms. You need to tell them also the dressing material that we use in the hospitals. And commonly, the most common one dressing that we have is the 4x4 gauze. The most common. And that is exactly what we have here. Or this one. You can show them this one also. We have different sizes. It depends on the wound size. Okay? This is mid-pore.
Yeah.
Okay. But let them understand that aside from this wound dressing that we have, there are also several commercially prepared wound dressing. Some have impregnated medication on it. Some are made up of charcoal. Some are transparent, etc. etc. Okay? But basically what we have in the lab is the ordinary wound dressing that we have.
Simple there.
Yeah. Okay? Okay. Before you start the procedure, you need to explain also this very important part, which is the wound dressing technique. And this is critical element. Okay? There are 3 ways on how they can clean the wound. But regardless of the technique, it always starts from the center. Because the center of the wound is the cleanest. I'm talking about surgical wound. Because if the wound is infected, technically the center is the dirtiest. But since our procedure is surgical wound, the principle there is cleanse in a direction from the least contaminated area to the most contaminated area. And the least contaminated area should start from the center. And in outward motion, going around. Normally this one. However, there are variations in the technique, ma'am, that you need to emphasize. Like for example, this one. 1 on the center, 2 on the side, and the other side. But still, we start from the center. This is another technique also, ma'am. But cleaning always start from the center again. Again, the principle is there. And in the presence of wound rain, they can actually do dressing a bit also. Again, this is the most common technique that we do. Circular motion starting from the center in outward direction. And this is one of the most common questions that would appear in the clinical written exam. How do you clean the surgical wound? Okay? Gloving technique, okay? You can show it to them, but you will demonstrate it later on so that they will see exactly how you do your glovings. And this procedure requires technique, unlike the clean gloves technique. No technique is required. But this one, we follow certain steps because we do not want to contaminate the gloves. Because our goal here is to keep all the things that we use with the patient as sterile as possible. Okay. And after you discuss that, you can present this one, a small scenario, so that they will know the context and they will know why do they need to perform dressing. And you need to tell them that in the hospital, normally, the dressing is usually every day. Sometimes doctors are the one doing the dressing, but it is our role also as a nurse to dress the wound. That's our role in the hospital. And present this scenario, and then you can start with your procedure. Okay? Now, starting the procedure always starts with